I'm Marjorie from Senior Linkage Line Service. Today's training is to provide viewers with information on changes to Medicare that occurred in late 2020 and changes in 2021. Next. If you have further questions after today's training, please contact us at Senior Linkage Line 1-800 number, or we have a chat feature at minnesotahelp.info, or you can go to seniorlinkageline.com. Next. Senior Linkage Line is the designated federal SHIP, which is the State Health Insurance and Assistance Program for Minnesota. The Senior Linkage Line provides services that are free, neutral, and objective. We're funded through state and federal dollars. We won't recommend services or companies or health insurance over another. We're here to give you all your best options based on your scenario and your needs. We'll share all the information with you, and so you can make an educated choice. Next. If you need help, the Senior Linkage Line is here for you. You can reach us at our 1-800 number, in person, online, and via our live chat, Monday through Friday from 8 to 4:30. We work with all Medicare beneficiaries of any age, caregivers of these people, and persons of any age seeking assistance for help with the cost of their medications. Next. These are just some of the print materials that we have available to you at the Senior Linkage Line. They're all free for the asking. The Planning Ahead Guide has a lot of information on estate planning, powers of attorney, advanced healthcare directives. Our Healthcare Choices booklet we put out every year, and it has all of the Medicare plans who are authorized to sell Medicare supplemental insurance in Minnesota. The Medicare 101 is specifically for new people to Medicare, but it's also a good reminder for people that have been on Medicare for a while about how their Medicare benefits work. We have Senior Linkage Line kiosk cards and lots of magnets with our number and our partner's number, the Veterans Linkage Line and the Disability Hub. Next. Here's just the landing home page of our Senior Linkage Line website. And again, geared toward older adults, persons on Medicare, and their caregivers. Next. If you want timely email updates, you can sign up by going here. This is a page that you can get to from seniorlinkageline.com. And again, you can request by giving your email informational updates about your Medicare benefit. Next. There's lots of good work to be done here in Minnesota, and we depend and rely on our volunteers to help us extend our reach to the communities that we serve. If you have any interest in becoming a Senior Linkage Line volunteer, please call and ask for the volunteer coordinator in your area, and that person will contact you and discuss with you what some of those opportunities are in that region. Next. Let's talk about Medicare enrollment. Next slide. Medicare open enrollment runs from October 15th through December 7th each year, and it's the time of year when we can make plan changes for the upcoming year. It's important to remember that if you have a Medicare Advantage or Medicare Part D plan, those plans, those companies can make changes to your coverage. So this is a great time for you to learn about what those changes are and whether or not you want to continue with that company and that plan into the upcoming year. Make sure to review all your mailings from your current coverage plans, especially your annual notice of change. Every plan has to send one of those to every beneficiary enrolled in one of these plans, and it's really important because it will tell you what some of the changes are that are happening. Some of the changes that could occur could affect your premium cost, your deductibles, your provider network, your drug formulary, the overall costs, any benefits and or restrictions, and your coverage area. Next. Again, the period of open enrollment is from October 15th through December 7th. And if you're on original Medicare, this is the time that you can join an Advantage plan. You can drop or change your Medicare Part D plans, change your Advantage plans, or stay with original Medicare. You can also enroll in cost plans. And typically those are available any time of year in the current 21 counties that are still offering them in Minnesota. Next. Let's start by reviewing your Medicare options and the updates to original Medicare for the upcoming year. Next. So here are your two options. You can go with original Medicare Parts A and B, and then add optional coverage through a Medigap policy, and then join a Medicare Part D plan for your prescription drugs. You can also go with a Medicare Advantage or cost plan if one is available in your county. And sometimes the Part D plan will be included in your cost plan, but you also have the option to go to a standalone Part D plan with a different company providing your health and cost coverage. Typically, all of the Advantage plans will have the Part D enmeshed or enrolled right in it. These plans then will be the ones that submit the claims for your Medicare benefit. These are some of the costs for 2021 for your Medicare Part A and Part B if you only have traditional or a Medicare Part A and B, original Medicare. So you can see what some of those are. They do typically change every year, so that's important to know too. So your hospital deductible, for instance, is $1,484 in 2021, but that will change, most likely change in 2022. That's another reason why people do look at Advantage or supplemental benefits to cover some of those out-of-pocket costs for Medicare Part A and B. And again, that can happen when you're new to Medicare and during open enrollment. Next. Most people are eligible to get Medicare Part A at no cost because they paid into Social Security benefit for 10 years or more. People who don't or haven't will have an actual cost or premium to enroll and will have to buy into their Medicare Part A hospital coverage. The premiums are based on the number of quarters, again, that the person paid in to Medicare through Social Security payments and their payroll taxes. We're happy to report that there have been no consumer changes for 2021 announced for Medicare Part A in 2021. When and if changes are going to be announced, it will be in our Healthcare Choices online version. We update that as quickly as we can when there's a change with your Medicare. Next. Your Medicare Part B updates for 2021 are that your premium, or the premium that people pay monthly for most people, went up by $3.90. Again, for most people. Some people will be paying more because they have a higher income bracket. Some people will be paying less because they qualify and have enrolled in a Medicare savings program. But typically, the cost for most people in 2021 for their Part B annual deductible, one-time annual deductible, is $148.50. We'll talk more about this shortly. Next. There are a few updates for Medicare that occurred in 2020 that are worth reviewing, even though 2021 is coming or is here. In June of this year, Centers for Medicare and Medicaid Services established a prior authorization process that required certain hospital patients certain hospital outpatient services and dates of services on or after July 1st. So that's when these changes took effect. And again, it's not for everyone, but there is this prior authorization process requirement for some hospital patients. It really does depend on a lot of things, whether you're inpatient or outpatient, and whether or not you're going to go to a skilled facility for some rehab after your hospital stay. Some of this was done because of increasing costs with the Medicare program for certain services. And a lot of these services were considered cosmetic. Now, some services that might be cosmetic for one person may not be for someone else. I'll give you one example, and that would be the blepharoplasty, and that's a tough one to say, but it's the reconstruction of the eyelid. Some people may look at that as a cosmetic surgery, but others may need that because their eyelid has actually started drooping into their field of vision. So it would be a medically necessary procedure to have done so that you wouldn't lose vision. Next slide. Also, Medicare Part B covers some acupuncture services for people with lower back pain. So it's very specific to that lower back area, those that will be eligible for this service. There are typically 12 visits allowed that Medicare will cover, with an exception to get some more and no more than 20 in a 12-month period of time. Again, so you'd be talking to your physician about this, and you'd have to make sure that that acupuncture was provided by a doctor or a healthcare provider who has a master's or doctoral level degree in acupuncture or oriental medicine and have gone to an accredited school. Next. And this is the income-related adjustment that I was talking about for some people who are in those higher income brackets. 95% of us, will not fall into these brackets, but it's good to know that if you are in one of these higher income brackets, you will pay more on top of your general or standard Medicare Part B and your Medicare Part D premium. And it does list here what some of the bracket cost areas are and what the higher premium amount would be on top of the premium of that plan. Let's say you have a Part D plan that costs $17.20 a month, and you were married and filing jointly, and you were in this bracket of $176,000 to $220,000 income for your 2019 income tax filings, you would pay an additional $12.30 a month on top of that $17.20 premium for 2021. That's just merely an example, but I wanted to give you that. And again, this does not affect most people, but it is good to know because it can be very surprising to people in these income brackets when they're told that they're going to be paying this premium, then they see that they're paying a higher premium. This is why. Next slide. Now we're going to talk about some of the changes to Medicare Part D for 2021. Next. So in Medicare, or in Minnesota, there are 28 plans, Medicare Part D plans for 2021. The premiums are ranging from anywhere from $7.30 to $104.70, and this is for private pay. The national base premium is $33.06. So you can see from the $730 to the $104.70, there's going to be plans with monthly premiums all over in there. And I will just say that the best way to find out which plan is right for you isn't always, I want the $7.30 plan, unless you're taking no medications right now and you just want to have that coverage, the in-case coverage, and also not pay a late enrollment penalty for not enrolling in Part D. So it's good to know that the plan that's best for you is not necessarily best for your friend or your spouse. It's based on the medications you're currently taking and filling at the pharmacy. That's going to help determine which is the best plan and then consequently what the cost of that plan is. Next. Medicare Part D has 4 coverage phases, and this is just a standard Medicare plan example. We've got the deductible phase, we've got the initial coverage phase, the coverage gap phase, and the catastrophic coverage phase. It's important to note that costs in enhanced plans can also vary during the deductible and initial coverage phase. So we have to keep in mind that most plans are enhanced plans, so this could happen. People should use the Medicare Plan Tool Finder, and that's what Senior Linkage Line is here to do for you every year or when you're new to Medicare, to determine what your actual drug costs would be. Not all plans have a deductible, but the majority of them do, and it's anywhere from $0 to $445 in 2021. Next, please. So again, this just shows those phases with a little bit more information in the graph. The 0 to 445 for the deductible, and it'll depend again on which plan you choose. And then you're going to pay in the next phase, your initial phase or coverage period, the 25% or less for all of your medications. Then the next phase is the gap phase, and you will pay 25% of the cost of each med. And then there's the catastrophic phase, where your copay will be 5%, and the plan and the manufacturer will pay the 95%. Most people do not fall into that catastrophic phase, but it's good to know that it's there for those who need it. Once you go into that catastrophic phase and are paying the 5%, you're really paying the 5% or $3.70 for generics and $9.20, whichever is the greater. So either 5% or the $3.70 for generic and the $9.20 for brand name drugs. Next. This is showing partial extra help. So people that qualify for extra help or low income subsidy, they apply for this. It doesn't just usually automatically happen. Social Security administers this for Medicare, and we at the Senior Linkage Line can help screen you and help you apply. It takes less than 10 minutes. So their incomes for this partial, for a single person, an income limit would be $1,615 in 2021 and $14,610 in assets. So anything there or under. For a couple, it would be $2,175 income and $29,160 in assets. So what you can see here is that if you or your spouse qualify for partial extra help, you're going to pay no more than $92, anywhere between 0 and 92 for your deductible. And then instead of 25% in the full pay, 15% or less for your drugs in the initial coverage phase, and then 15% in the gap phase. And then again, it goes down in the catastrophic phase to 5%, or those $3.70 and $9.20, like I had mentioned before, whichever is the greater of the two. Next slide. This slide depicts the full extra help benefit with low income subsidy or extra help. So it's showing no premiums, no deductibles, and then just basically the low copays for your generics and your brand name drugs throughout all the phases, initial and gap phase. And then if you do hit catastrophic cap, which is unlikely, you'll have no copays when you get into that phase. So people with incomes at or below 100% of the federal poverty level, which is $12,760 for singles, will pay the lower amounts. People who are deemed eligible will automatically get a full subsidy. That means they're on medical assistance here in Minnesota, or medical assistance with a spend down that has been met at least once in that coverage period. So that means they've had to meet their medical spend down 1 month, and then they will qualify for this benefit. if they're on medical assistance with a spend down. Also, people on medical assistance for employed persons with disabilities, people who are eligible for Medicare savings programs, and people on supplemental security income. A person can enroll in any plan and copays will remain the same if the medication is covered by the plan. If the person enrolls in a plan that is not a Minnesota benchmark plan, they must pay the portion above the benchmark allowed amount out of their own pocket. So it's really, again, important that you make sure that you're in the right plan for you when you qualify for this benefit of extra help. Next. These are just showing the 2021 benchmark plans. There will be a need for some people to be on a non-benchmark plan because of a med they're on. It does happen, but it's not typical. Again, Senior Linkage Line is here to help you figure all that out. It's not something you have to memorize or know, but for those who are tech savvy, they are welcome to go to the Plan Finder tool at medicare.gov to compare their own plans. Next. Another new program that's brand new in 2021 is the Medicare Part D Senior Savings Model. At least 1 in 3 people on Medicare are diabetic, and over 3.3 million Medicare beneficiaries use one or more of the common forms of insulin that are out there on the market. The Senior Savings Model was designed by Centers for Medicare and Medicaid Services to offer insulin at an affordable and predictable cost. We know that insulin can cost a lot, even something that's been on the market for a long time. So what this means, this savings program, is that there are select plans, not every Part D plan, but there will be select plans that will offer lower out-of-pocket costs for certain insulins. You can find out which those plans are that are working with the Senior Savings Model by selecting a box in the sort option on that Medicare Plan Finder tool. Again, for those of you doing your own checking. People should be able to get a wide range of insulin products, and a 30-day supply will cost no more than $35 for those plans that are participating. So $35 for participating Part D plans. The average cost savings is expected to be about $446, if not more, each year. Then we have the Minnesota Insulin Safety Net Program. So these are for people with urgent needs. And I'm sorry, next slide. So people with urgent needs, like they are running out of one or more of their medications and only have seven days left. And then we've got a continuing need program. That is the one that would work for the people who are enrolled in Medicare and Medicare Part D if they meet certain requirements. And we'll talk more about that on the next slide. So again, the urgent need program for insulin is the less than 7-day supply, must have a current prescription. They'll pay, if they pay more than $75 a month for their insulin, they'll be qualified. And again, this is not available. This urgent need program is not available to our Medicare beneficiaries. They will move towards the second program, the continuing need program. So even though they may have Medicare Part D, they may find that the costs for their insulin are not affordable, and then this might be the right program for them. They will have had to spend at least $1,000 towards their drug before they can become eligible for this. And they also can't be eligible for other federal drug programs like through the Veterans Administration. Next. So going back to the first program, the urgent need that's for the non-Medicare population, it's a one-time fill of a 30-day supply at $35. And for the continuing need program, which is the people we serve, these Medicare folks, the manufacturers will supply the insulin for up to 1 year, and you must renew annually for that program if you want to keep going on it. And again, you will have the Medicare Part D insurance, but it just may not be providing you the coverage you need at the cost you can afford. So that's the one, again, that you have to renew annually. And once you're eligible, the manufacturers will actually take care of most of the cost for that insulin prescription. If you enrolled in January, you would be covered for the rest of the year. If you enrolled in continuing need in November, you would have to re-enroll in January. Next slide. There have been several changes through Centers for Medicare and Medicaid Services, and they're temporary changes as a result of the coronavirus pandemic. Over the past months and years, they have been continuing to update and clarify some of these changes. Next slide. Some of those changes include Medicare will cover the lab test for the COVID-19 and the future vaccine. Now, this doesn't mean it's like a forever thing, but these are temporary changes. So right now, Medicare is saying that they will cover the lab tests to test for COVID, and then the vaccine that has going to be out there for different people at different times. They'll also cover the FDA authorized COVID-19 antibody tests if the person was diagnosed with COVID or an infection is suspected. So that's to check if you have the antibodies. You may be asymptomatic, but they're checking for the antibodies to see if you have had COVID exposure. Medicare covers all medically necessary hospitalizations. This includes people diagnosed with COVID-19 who might otherwise have been discharged from the hospital after an inpatient stay, but instead they need to stay longer because they're under quarantine. Medicare is allowing Medicare Advantage and Medicare Part D plans to waive or relax prior authorization restrictions, and those things will depend on the plan. It'll vary from plan to plan. People affected by the pandemic who need skilled nursing care may be allowed to receive that care without a qualifying hospital stay. That's really important because if you don't have a qualified hospital stay, you may not be able to get Medicare to pay for your skilled care or rehab. So waiving that or loosening those restrictions is really important during this time. Finally, Medicare has expanded their telehealth services, both virtual, audio-only technology. This includes virtual check-ins with your doctor or physician, evaluation, management of illnesses, mental health counseling, and preventive screenings. Next slide, please. Now we're going to talk about the Medicare health plans. In Minnesota, we have two types of Medicare health plans, the Medicare Advantage plans and the Medicare cost plans. Next slide. Medicare Advantage plans are offered by private companies that assume the Medicare benefit for the enrollee. So they're taking care of the claims and the administration for Medicare. What this means too is that there's only one claim going forward. It's not going just to two different places. It's going just to the Medicare Advantage, and they're administering for Medicare. Medicare Advantage plans are also known as Medicare Part C and can be the only payer, as I mentioned, when a person enrolls in that type of plan. In 2021, we have several plans leaving the market and also several new plans coming into the market. So, and that's not unusual. There's always new plans coming in both to Medicare Advantage and Part D, and potentially some leaving the marketplace each year. If you have a Medicare Advantage plan, you should carefully read the information that comes to you from your plan. Next slide. These are the types of Advantage plans. There's HMOs, or health maintenance organizations, and they're private plans that are locally based. So private plans meaning a private insurance company runs them, and they get permission from Medicare to be an Advantage plan through Medicare. They have monthly premiums and deductibles and coinsurances and co-payments. Depends on which plan as to how much you're paying there. So there's no such thing as a free HMO in Minnesota. It's important to know that because there's a lot of ads on TV inviting you to call for those plans that are free. They don't exist here. So a lot of the stuff that we see on TV is just somebody buying ad time and trying to get you to call. But if they're worth their weight in salt, they will refer you quickly back to the state SHIP, the Health Insurance and Assistance Program, which is the senior linkage line. HMOs, you'd get your best benefit when you use the plan's network. So the provider network is really important to use, or you're going to pay higher or even possibly full cost if you don't stay in the plan's network. An HMO point of service plan is very similar. You can go outside of the network, but you will expect to pay higher co-pays and co-insurances when you go out of the network. There's preferred provider network plans that allow a beneficiary to pay less by seeing providers in the network again, or pay more by seeing providers outside of the network. The plan does not require the beneficiary to select a primary care provider. Often those plans will be regional, so they might be offered in Minnesota, Wisconsin, and the Dakotas. That's just an example. It doesn't have to be that way, but sometimes that's how the preferred provider networks work. And there's special needs plans. These are limited to special populations here in Minnesota, such as people with Medicare and medical assistance, and people with certain chronic health conditions, like diabetes or people living in an institution would be an example. Private fee-for-service plans, you can see any provider that agrees to accept the Medicare assignment, and the beneficiary bears most of the responsibility to ensure that the plan accepts payment for each visit. So that means that there would be an extra step or hoop for the actual enrollee to make sure that where they're going accepts that plan. Then there are Medicare medical savings accounts. Both are high deductible health plans and a health savings account. Here are the two parts of the Medicare savings account. A high deductible plan that will only start to cover when a person has met that high deductible amount, whatever that might be. The deductible, of course, will be different for each plan. And then a Medicare savings account, which a plan deposits money tax-free for the enrollee. Person can use this account to pay for any costs that come up before they've met their deductible. So they're quite different. Next slide. And then again, we have Medicare cost plans in 21 counties in Minnesota at this time. So up until 2019, they were available in all 87 counties, but after that, they went to 21 counties. So if you happen to live in a county that offers cost plans, this is an option to you. You can typically get into those plans any time of year that they're accepting new enrollees. They do have a network, but you can see providers outside of that network and go to your original Medicare. You're responsible for paying the cost sharing. And again, if you live in one of the counties where one of these are available, you can look at these in addition to Medicare Advantage plans. Next slide. This is just a graph showing those 21 counties where the cost plans in Minnesota are currently available in green. Next slide. Beginning in January of 2021, Medicare Advantage plans are authorized for the first time to cover persons with end-stage renal disease. Prior to 2021, Medicare Advantage plans could not cover end-stage renal disease or enroll beneficiaries with the disease into their plan unless they were enrolled in the plan prior to developing or contracting end-stage renal disease. Original Medicare pays for the organ procurement, just so you know that, not the Advantage plan. But this is really important to know because it's a brand new change that's going to affect a lot of people who are living with end-stage renal disease. Next slide. Some plans offer supplemental benefits to beneficiaries or enrollees, like home-delivered meals, transportation, pest control, The transportation, the non-medical need transportation could be like to the gym or things like that. The plan itself will decide who would benefit from this. So a person unfortunately can't just choose one of these plans and hope to get these supplemental benefits. The plans have a way of vetting based on the chronic condition and whether or not other methods are not working for that disease. So an example would be someone is exercising with diabetes and really keeping it under control and doing a great job on their own and just are very fortunate, whether it's genetically or otherwise. And another person with that same disease trying those very same things may not be getting the same results. So that plan may decide to give that enrollee additional supplemental benefits to help them manage that disease. Next slide. If you're taking medication that is subject to step therapy, the plan can require you to try less expensive medications before the plan will pay for the more expensive medications. So what that means is you will go to your doctor, they will have you try the lower expensive medication. That doesn't work for you, it's not effective, or it has adverse side effects for you. So in those cases, then you're stepping to another drug or even another drug until maybe you're on that most expensive medication for that condition because it's the one that works for you. But it's called a trial and the doctor will be involved. But the plan does, obviously, to save costs for everyone, want people who can be on the lowest cost medication for a condition. They want you to be on that one if you can be. So that's what that is about, the step therapy. They've always been able to do that at the plans, the Part D plans, but now the Medicare Advantage plans will be allowed to use this for medications that they cover under Part B of your Medicare. So drugs that are used with durable medical equipments, for instance, inhalers, nebulizers, that would be an example, some antigens, some injectable or infused medications, and immunosuppressive drugs. They can also use at the plan some other methods to manage, such as prior authorization. And sometimes, again, it involves getting your prescriber, your doctor's office to get involved in your care to get some of those meds. This isn't the majority of people, but it's good to know that these things are out there. And if you have questions, you always call the senior linkage line and we can help connect you to some of these things, including the forms that the plans use to have a person request a particular drug or an exception. Next slide. Another change in 2020 and 2021 was the expansion of the telehealth benefits. So Medicare Advantage plans can include additional telehealth benefits beyond what Medicare allows in their bids for basic benefits. So that just means the Medicare Advantage plan enrollees may get additional Medicare Part B healthcare services from places like their homes, or rather than going into a healthcare facility. A good example is I'm feeling very ill and I have access to the equipment. I can do a telehealth visit rather than come in, and my doctor can see me that way and decide whether or not I need to come in or if I need to be admitted. That's really important in these times. Medicare Advantage plans have a broader flexibility in how they pay and expand their telehealth benefits. So again, this is a building service. It's unfortunately not available to everyone because we just don't have the telecommunication equipment everywhere that we need it in every home, but it is building and it'll become much more commonplace and popular. Next slide. Plans with low enrollment in existence for are plans that are in existence for 3 or more years in the marketplace, but they aren't allowed to renew for 2021. Those are plans with lower enrollment operating in service areas that don't have a sufficient number of competing options. Cost plans, employer plans, or Medicare savings account plans could be part of this. Next slide. Centers for Medicare and Medicaid Services have special enrollment periods for exceptional circumstances for some people. Special enrollment period for employer union group plans, elections, special enrollment periods for individuals who disenroll in connection with a Centers for Medicare or CMS sanction against the plan, special enrollments for government entity declared disaster or other emergency. Two new special enrollment periods are individuals enrolled in a plan that has been identified by Centers for Medicare Services as a consistent poor performer. So that would allow somebody to get a special enrollment and get into a different plan if they're in a plan that's been deemed as a poor performing plan. Also, individuals can get special enrollments when they're enrolled in a plan that's been placed in receivership, meaning it's going to either be absorbed by another plan or it's just going away completely. Next slide. Medicare Advantage plan open enrollment period is January 1st to March 31st. So Medicare Advantage plan enrollees have this additional 3-month period to make changes to their coverage. Maybe they're disenchanted with the plan they enrolled in during regular open enrollment, or they just decided they wanted to make a change and go back to original Medicare and a Part D plan, or enroll in a whole new Medicare Advantage plan. It's possible if they live in one of the 21 counties, they could also get into a cost plan and a Part D plan. These plans don't go into effect until the first of the month following enrollment. So if you enrolled in January, it'll be February 1st. If you enrolled in February, it'll be March 1st. You have to have an Advantage plan to begin with to be able to use one of these Advantage plan enrollment windows. Next slide. So this is just showing the landing page on the Medicare Plan Tool Finder at medicare.gov. Anyone with internet can go to medicare.gov and do the comparisons in the Medicare Plan Finder tool. It's safe, it's secure, and unless you're enrolling, you don't have to worry about using any personal information. If you do choose to enroll, it takes you to a secure enrollment site. So this is available again for all of us. Senior Linkage Line uses it every day to help beneficiaries look for the best plans for them when they're new to Medicare or during open enrollment each year. It sorts the plans for us based on several different things. There's filtering tools, and it's actually quite easy if you've maneuvered on any site like this before. It's a really good government website. Next slide. This is showing some of the changes, and by changes I mean some improvements from last year's Plan Finder tool to this year. They are cleaning it up. Either the font is getting bigger or there's less verbiage on a page, so it should be easier to read for a person. Next slide. And then this is just, if you go onto the page again, you'll notice these are some, if you've been on it before, you'll notice some of these differences, like aligning the Plan Finder with other Medicare applications, small updates made throughout the Plan Finder, minor adjustments to the styling, the font and layout and things like that, formatting, improved readability and consistency. Next slide. So this is just another before and after on one of the changes. And it's just showing how the plan view looks to you when you're looking at a particular plan compared to what it looked like before. So obviously it's bigger, right? So we can see that a little bit more clearly, the information that we're trying to look at. And then the next slide. And now it will also show you things like pharmacies, where they are in relation to your zip code. We've never had this mapping device before, so it's really nice. We can kind of give somebody an idea of what is the closest pharmacy to their home. That's really important when you're not using mail order, or, you know, we've had a snowstorm here in Minnesota. You can increase the size of this map to look at it, and you can vertically stack pharmacies based in, and they'll show where each of those pharmacies are by number. Next slide. The Medigap tool has been redesigned on Medicare.gov. It provides more targeted price ranges for you. And a lot of people aren't aware that because it's not run by Medicare, that we even have Medigap information on the Medicare website, but we do, and we want people to be aware of that as well. Next slide. So again, that's just showing another landing page for the Medigap policies. So you can get a lot of information there without ever needing to call an agent that sells a Medigap policy. So that's kind of important too, because a lot of people want to look before they actually talk to an insurance agent. Insurance agents, of course, are the only ones that can help you enroll in these plans. So you can talk to Senior Linkage Line about them, but we cannot help you enroll in a Medigap policy. We can help you with the Medicare Advantage plans, cost plans, and the Part D plans. Again, this is just a really good way to get comprehensive information about all of your options by going to this Plan Finder tool at Medicare.gov. And anybody, again, with internet can see this. Next slide. So again, this is just another view of the policies page for these supplements. Next slide. Cases of fraud and abuse are on the increase. This often happens when there's just changes in general in our world. COVID can bring on new fraud and scams. Even good things like somebody getting a surplus from their state, a tax refund. That's when the scammers come out. So we have to be always on vigilant and on the watch for that. Medicare Department of Commerce oversees all of our health insurance plans who are authorized to sell insurance in Minnesota. So, and they're doing a great job at that, but also Senior Linkage Line, we're really looking for that. And we want you to report to us when you run into issues that you're concerned about, whether it's a scam or a fraud with your health care. Very important to report those and get those scammers shut down. And also it's really important too, because we don't want our Medicare dollars going towards fraudulent activities. That's just less that all of us get towards our health care. So again, very important to hang up. If somebody is soliciting you, either by email or by phone or solicitations at home in your mailbox, we can tell you who the credible resources are for things like health insurance and long-term care insurance and things like that. You should never be just approached and expect that that's a good idea to give information about yourself, about your income, your Medicare, Social Security, any of that information. It's just really important. Medicare and Social Security do not make house calls. So that's your first clue. If you're being approached and someone says they're from Medicare or from Social Security, you hang up. You know that that's a scam. It does happen. Again, we do a pretty darn good job in Minnesota, but we can't stop everything. So we really rely on you and each other to be vigilant and be aware. And tell all your loved ones too, because this can happen to people of any age, not just persons 65 plus. We're all at risk. But yeah, another thing is the free neck braces, knee braces, things like that. You'll get those or you'll see them on TV. Please don't call those numbers. If your doctor prescribes the neck brace, you'll get it through a qualified durable medical equipment provider. And if you're just calling a 1-800 number, what happens is it might be free. You might actually get it in the mail, but they now have gotten some very important information from you and can use that Medicare information to submit false claims to Medicare for payment. So just be on the watch. Thanks. Medicare also and Senior Linkage Line, we do health insurance fraud presentations, so you can look into that at any of your local agencies on aging. Next slide. And please, please just call us with your questions. We really appreciate your calls. You can go to the chat again at minnesotahelp.info or seniorlinkageline.com or our 1-800 number, 1-800-333-2433. Thank you.